Hi, Brennan. My name's Laura, and I'm going to be your occupational therapist today. Nice to meet you.
Nice to
How are
meet
you doing today?
Good.
Awesome. So, today I was just reading over your chart, and I see that you've been having some pain in your wrist and forearm area. You were walking your dog and you fell.
Mhm.
So sorry to hear about that. Well, I know that you're a student and you need to get back to picking up your book bag and your books, and even holding that coffee mug, I bet, is hard. So, we're going to do something today to help decrease that pain that you're having. So, what would you say your pain is at right now? Like in between 1 and 10?
An 8.
An 8? Okay, so yes, we really do need to do some type of modality that will help with that. And what I have in mind is called just a mini electrical stimulation unit, and it's called TENS. And what it does is it's going to send electrical impulses into your tissue using these electrodes, and we set specific parameters to help with the regulation of that electrical stimulation. And it specifically will help to decrease that pain. But before we do that, I just want to make sure that you're a good candidate for it. So, do you have a pacemaker?
Mm-mm.
No? Okay. What about, are you pregnant?
Mm-mm.
Okay. Do you have any history of epilepsy?
Mm-mm.
What about malignancy?
Mm-mm.
All right. Do you know if you have like a peripheral vascular disease or any history of that?
No.
Okay. Do you have any undiagnosed pain like that's not in this area?
No.
What about any pain in your brain or like in your back region, spinal cord?
No.
No? Okay, and then we're just not going to do it over specific areas. We're just going to keep it here. And then I'm going to also test your sensation. So if I can I'll take both of your arms here, and I want you to close your eyes, okay? I want you to let me know, can you feel that?
Mhm.
Okay, does it feel the same as that?
Mhm.
All right, can you feel this?
Mhm.
All right, does that feel the same as that?
Mhm.
All right, and can you feel this?
Mhm.
And does that feel the same as that?
Mhm.
Alrighty, perfect. You can open your eyes. All right, and then a couple more questions. Are you on any medications?
Mm-mm.
Nope, no medications. Okay. And then I'm just going to look at your skin here. You are in the acute phase. I know this happened a couple of days ago, so it's a little bit red, but nothing to be worried about. You don't have any wounds or anything. And then, do you remember what you had for breakfast today?
A banana.
A banana? Okay, so your cognition is good. So it looks like you're a good candidate. Do you think that this would be something that you'd like to do today?
Sure.
Alrighty, perfect. So the benefits of this, like I said, is to decrease that pain, especially since you have an 8 out of 10 pain right now. And some risks is that these electrodes can cause a little bit of skin irritation because they kind of have a sticky backing to it. But that should go away, and if it's red or anything, that should go away too. Okay? So the first thing I'm going to do is clean this area just so they stick well. You don't have very much hair there, so that's good. I'm sure they'll stick well. So there's a red cord and a black cord, but that doesn't matter for this TENS unit. So it doesn't, we're just going to place them wherever you're having that pain. So it's right here. I don't want to press on it too much.
Mhm.
And then I just want to make sure that I place the second one at least a pad's width apart. So I'm going to place it like right about here, okay?
Mhm.
And we can always alter the placements of this depending on your pain level too. Okay, so the next thing we have to do is there's specific parameters on here that kind of get a little bit confusing, but I'll make sure that I'll write them all down for you so you can take this home. Okay, so first you're going to turn it on, and you're going to go into the TENS, and underneath it says N there. Okay, so the first thing that it's going to give you, you're going to press set, and you want to look at your rate. So a good rate for, we're trying to do sensory because you have acute pain, is in between 80 and 100. So we're going to set that at 80. And then for your width is in between 80 and 100 as well. So we have that set at 80. And then we have asymmetrical. That means that we're doing a small muscle right here. We would put on symmetrical if it was larger. And that looks like it's good, so then we can press this little lock button here. Alrighty, so make sure that they're all in contact, that this is plugged in. Alright, so I'm going to start pressing the amplitude or intensity up, and I want you to let me know when you start to feel a little bit of sensation. Okay, your ultimate sensation level should be a comfortable but tingling feeling, okay? anything yet?
Not yet. Now I feel a little bit.
Okay. Try to go up one more.
You can go up one more.
Okay.
Okay, that's good.
That's good. Okay, so we can just go ahead and push that lock button so then you can hang out here with this. I'll be here the whole time. I have it set for 25 minutes right now, but the good thing about doing the sensory mode is that you can actually have it on as long as you want because it's targeting the nerves and your nerves aren't going to get tired. So when you are at home, if you want, you can kind of keep this with you and have it on as long as you want to help decrease that pain. Okay? So do you have any questions about this?
No.
Alrighty, awesome. So I'm just going to go ahead and turn it off now, and then you can practice doing all those parameters, okay?
Okay.
All right, thank you.